depressed person to become highly narcissistic and focus only on the self. During this time, one can only focus on the self and not on anything in the external world. This preoccupation with the self is why a depressed person is highly sensitive and quick to take offense at minor instances. The roots of depression can often be traced back to one's childhood. Children who have not experienced feelings of secure love and holding by their caregivers in their early years often grow up feeling not good enough. People with low self-regard and impaired self-esteem are more likely to fall prey to depression because feelings of worthlessness are already part of their inner world. Children who have been separated from their parents either by death or illness or have gone through neglect and trauma grow up with chronic feelings of disappointment and being let down. Such children live with a heightened sense of loss and are more likely to experience depression in their adult lives. No matter how many people go through depression, each person suffers in his or her own way, which is why it often becomes difficult for loved ones to understand what is happening to us and for us to communicate it to them. When we are unable to explain to them what we are going through, we retreat further into our depressive shells. Yet inside us, there is a strong need to be understood and to be helped. We seek love and care, yet we push it away because we are unable to feel any positive emotion. Psychodynamic therapy seeks to help those suffering from depression by initiating structural personality change rather than focusing only on symptom relief. The aim is to help resolve the underlying feelings of worthlessness and to facilitate the mourning and letting go of the lost love object. The therapist helps the patient revisit and deal with painful childhood experiences while providing the care and holding that the patient missed out on in his life. The alliance between a therapist and patient is one of empathy, nurturance, and understanding. As patients gain insight into the workings of their inner world, they become more attuned to their true emotions and are better able to create strategies to cope with losses that they might face later in their lives. Psychodynamic therapy is therefore focused on long-lasting and in-depth intervention. Coming out of depression is hard, but it is not impossible. It is possible to find support, to find a small ray of hope inside the hopelessness. We need to remember that there is a way out of the black hole, because there can be no shadows without there being light. All we need to do is reach out.